Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. National Association of Resident Doctors insists suspension of industrial action is conditional pending government's response to their request by the end of April. And Africa must expand vaccine manufacturing to combat the COVID-19 pandemic and future health emergencies, says African leaders and international health officials at virtual vaccine manufacturing summit today. And India reports more cases of COVID-19 infections overnight, overtaking Brazil to become the second most affected country globally. The Nigeria Center for Disease Control, NCDC, is still reporting an increase in the number of cholera cases being reported across states in the country. The agency, in a tweet, is asking Nigerians to ensure they take precaution and ensure environmental and physical practices are enforced and practiced by all. On the daily record of COVID-19 cases, no new death was recorded last night, while one person was reported to have died of COVID-19 complications in the previous 24-hour cycle. The coronavirus fatality toll in Nigeria stands at 2,060, with Lagos topping the list of states that have the highest number of casualties, 439 deaths, followed by Edo State and the FCT. According to the NCDC, the country recorded 57 new cases, one of its lowest infection figure so far this year. The figure, which is slightly lower than 84 cases reported in the previous 24-hour cycle, has raised the total number of infections to 163,793. The new cases are reported from 7 states, the FCT recording 20 infections, followed by Lagos and Bayelsa, and others, Kaduna, Rivers, Osun, and Jigawa states. The agency also reports that while 25 patients were discharged on Saturday, 9 patients were discharged yesterday after recovering from the virus. Currently, Nasarawa State has the highest number of cases on admission, while Ogun and Sokoto states have the lowest, reporting 1 case each. Meanwhile, over 7,000 infections are still active in the country, and the country has carried out over 1.8 million tests so far. Vaccination across states in the country is still ongoing as many Nigerians continue to get the much-needed protection against COVID-19. The Emir of Kano has also joined the list of prominent Nigerians who have received the first shot of the vaccine. Talking about the former Emir of Kano, asking other Nigerians to consider their safety first and protect themselves. Now, according to African leaders and international health officials, Africa must expand vaccine manufacturing to combat the COVID-19 pandemic and future health emergencies, including forging partnerships to boost expertise and investment. Participants at the Africa Vaccine Manufacturing Conference say that the continent has struggled to acquire coronavirus vaccines and import the vast majority of its medicines and medical equipment, leaving it at the mercy of overseas supplies. The chairperson of the AU Commission, Musa Faki Mohammed, says the vaccination of Africa is urgent in view of the global pandemic ravaging the world. Also present at the virtual conference, the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, says that more than 700 million vaccine doses have been administered globally, but over 87% have gone to high-income countries, while low-income countries have received just 0.2%. The WHO DG maintains that the pandemic has shown that global manufacturing capacity are not sufficient to deliver vaccines and other essential health products to where they are needed quickly. Meantime, the World Trade Organization Director General Ngozi Okonjo-Iweala at the meeting also said that It was morally unconscionable and a serious economic hit that just 1.1 per 100 Africans had received a vaccine, while in North America the rate was over 40 per 100. She says, quote, between a steeper fall and a weaker rebound, Africa will have a lost ground to other regions. So to boost growth, trade and livelihoods, we need to get vaccines to everyone who needs them. The president of the National Association of Resident Doctors, Dr. Ilawa Okayesui, says the suspension of the industrial action embarked upon by resident doctors in the last 2 weeks is conditional, as the leadership of the association will review government's response to their request by the end of April. President of the association, who addressed journalists in Abuja, maintains that the government has failed to honor the agreement it reached with the association in the last 5 years. According to him, NARD will meet at the end of the month to review the level of implementation of the recent memorandum of action reached with the government in order to determine the next line of action.
The government has failed to honor the memorandum of actions or memorandum of understanding for over 5 years. The time when doctors seems to go on strike is because government have not been able to honor their bargain made on the table that we have signed. We talk of the hazard allowance, talk of the death in service insurance, talk about other things, talk about the dilapidated state of most hospitals in Nigeria generally. And those are why we have always asked the government to take the priority of the health sector to be very important. But as it stands, we are patriotic Nigerians and we are not hungry to go on strikes if only government honor their own bargain. And for next 4 weeks, we hopefully wish that the government will honor their bargain. But however, the National Executive Council have placed a meeting for the 4th week to review the state and the extent in which government have gone to honor the MOA. So it's at that stage we are going to review what we are given and know whether the government have done well or not.
And following the suspension of the industrial strike by NARD, activities in major government hospitals across Nigeria continue without much hindrance. Speaking to our correspondent, the Chairman Medical Advisory Committee of the Lagos University Teaching Hospital, LUTH, says that during the 2-week strike period, consultant doctors and other health workers were on ground. The resident doctors decided to call off the industrial strike due to the meeting with government officials until the end of April.
The National Association of Resident Doctors, some few days ago, I think less than 2 weeks ago, they declared strike. It's not a local strike. It's they have some issue to discuss with the federal government, and since then, the federal government has been engaging them. And I think yesterday, on Friday, they had a meeting, final meeting, and they decided to come back. It is expected that they're back. I've been to the clinic, and I've seen some of them. However, you know that we never close down the hospital, because apart from resident doctors, we have consultants who are the top echelon of clinical care, and they've been doing their work. And also we have some house officers, despite the fact that one of the reasons why they went on strike was because of the non-payment of house officers. We still have some house officers. We had some medical officers and other willing residents during the period. So we scaled down, no doubt, but our clinics were hopeful, and are still hopeful. And also, patient in the hospital, no patient was actually discharged because of the strike. We try to manage within the available resources, and it is good that the crisis was resolved as soon as possible. So we are back, and we are good to go.
And from Lagos to Yobe State, where the government says it has recorded over 700 rape-related cases, mostly involving minors during the first and second waves of the coronavirus pandemic in the state. The Commissioner for Health there stated this at a training on clinical management of rape and intimate partners during the COVID-19 pandemic, organized in partnership with the World Health Organization in Damaturu, the state capital.
A decay in societal norms. That's how the Yobe state government describes the seemingly unending cases of sexual violence being perpetrated in the state in spite of laws in place to serve as a deterrent. It's a worrying situation, more so because many cases of rape were reported during the first wave of the COVID-19 pandemic, with an unusual surge during the lockdown. Similar abuse was reported well into the second wave and long after restrictions were eased.
From the data we received from these centers, we have recorded over 700 cases, and primarily most of these cases are either rape or intimate partner violence that have been reported and managed in those units.
To provide proper care for survivors, the World Health Organization is partnering with the state government to ensure doctors, nurses and midwives are properly trained in the area of clinical management of rape and abuse between intimate partners.
When it comes to treatment, what the health worker knows is as important as what he or she provides to the survivor. So in order to close the gap and ensure that our health sector is strengthened to be able to provide these services, we decided to start by equipping the health workers so that when survivors arrive at the health facilities, they can have holistic care as regards gender-based violence.
Participants have gained a new insight into the management of gender-based violence survivors. Now they are asking state government to hasten assent to the Violence Against Persons Prohibition Law to allow quick dispensation of justice.
I would like to use this opportunity to plead with the government to implement this bill because it is very, very much needed. I believe with that bill it will play a very important role in declining or reducing the level of the cases of rape in our society.
They believe tighter laws will discourage perpetrators and lower the statistics of victims.
Now we go over to Ebonyi State, where vaccination campaign has continued in earnest. Joining us right now is Dr. Catherine Barry-Oko, Executive Director, Ebonyi Primary Healthcare Development Agency. She joins us via Zoom. Thank you for joining us on the program.
Thank you.
All right, I'd like to quickly ask how vaccination has progressed so far and what the plan is, seeing as vaccinations into Africa, vaccines in Africa are quite limited.
The vaccination in Ebonyi State has been going on very well. People have been responding. People are even coming to the office to ask us for the phase 2 that will soon start, maybe June. So the vaccination has been going on very well. And we have been trying our best to make sure that those that the target group are being vaccinated. Like the frontline health workers, we have almost finished the vaccination. And then we are hoping that the second phase will go on very well. So everything is being on control and things are going on very fine. Even the commissioners, everybody, like when we started newly, when we carried the vaccine from the airport, immediately the day we came back, the next day we went to the government house to vaccinate the governor, which was done. The wife, the deputy governor was also vaccinated, and the wife, and some ESCO members. And later, we continue vaccinating. Even the ESCO members, we later continue vaccinating them. So for now, things are moving on very well, and people are eager to be vaccinated.
We'll come back to you. Let's quickly take a short break. The COVID-19 update program continues shortly. Stay with us. Welcome back. Still with us is Dr. Catherine Barry-Oko, Executive Director, Ebonyi Primary Healthcare Development Agency. Thank you for staying with us. And finally, this is about if there have been any reported adverse reactions to the Oxford AstraZeneca vaccine rollout in the state. And in your estimation, are the NPIs still intact? Are people still adhering to the pharmaceutical, non-pharmaceutical protocols?
Actually, there is advanced effects, but they are not serious. So in some local governments, we have some, but they were handled. Because none was even led to admit the person that had it or the care that had the adverse. So it was managed at the local government area. Even some that had the like some that are it happened to the Ministry of Health. But not managed because they were not. So we had a serious one that led us to an admission. So that's
All right. We'd like to thank you, Dr. Catherine Barry-Oko, Executive Director, Ebonyi Primary Healthcare Development Agency. Thank you for joining us on the program.
thank you very much.
Now, outside Nigeria, Britons are back on the streets today as the government loosens COVID-19 restrictions and as the number of vaccinated people rises. Shops are open, we hear. Leisure parks are open as well. It appears that it really is a new day. Take a look at our global update.
Britons queued up outside retailers across England on Monday to release their pent-up shopping fever as England's shops reopened after 3 months of lockdown. After imposing the most heavy restrictions in Britain's peacetime history, Prime Minister Boris Johnson said the reopening was a major step towards freedom, but urged people to behave responsibly as the coronavirus is still a threat. In London's Oxford Street, dozens of people queued up outside Primark and Nike Town, undeterred by the unseasonably cold weather. India has reported a record 168,912 COVID-19 infections overnight, overtaking Brazil to become the second most affected country globally by the coronavirus. The country's overall tally reached 13.53 million, surpassing Brazil's 13.45 million cases, according to data compiled by the media. The United States led the global tally with 31.2 million cases. It also showed that deaths in India stood at 904, taking the total to 170,179. The total number of confirmed COVID-19 cases in Latin America has exceeded 26.3 million as of Sunday, with Brazil leading with about 13.5 million. Brazil registered 1,803 deaths from COVID-19 in the last 24 hours, bringing the national death toll to over 355,000. The country has been experiencing a new wave of cases since January, and many states have reported an overloading of their healthcare system.
Hong
Kong's chief executive, Carrie Lam, says the regional city will loosen some measures for residents who have been fully inoculated from late April as authorities seek to boost the take-up of vaccines in the global financial hub. Bars and pubs, which are currently shut, will be allowed to resume operations in phases provided all staff and customers have been vaccinated. Visitation to public hospitals and care homes could also be permitted for vaccinated people.
And from the global report back in Nigeria, where last week the Secretary to the Government of the Federation and Chairman of the PTF announced the transitioning of the Presidential Task Force to the Presidential Steering Committee. What does this mean? Joining us from our Abuja studio is Dr. MUKHTAR Mohammed, National Incident Manager, former PTF, now PSC, Presidential Steering Committee on COVID-19. Thank you for joining us on the program.
Thank you for having me, Millicent. Good evening.
Good evening. So what exactly does that mean, the PTF's transition to the PSC? And also, in view of all of these changes, we're seeing some state governors who are relaxing restrictions, events, large gatherings. Can we say that we've passed the critical, most challenging moments of the pandemic?
Thank you, Millicent. If you recall, Mr. President had extended the tenure of the Presidential Task Force from end of December to March 31st. But after this extension, there was a careful review of where we are. And the President approved that the PTF transitions into the Presidential Steering Committee. What this means is not that we are over, the most urgent phase yet. But it means that we are moving towards a more sustainable response. If you recall, the PTF was the emergency, body that involves both policy as well as operations, of the COVID-19 response in the country. So this transitioning, is a move towards sustaining the effort, pushing more responsibility to the ministries involved, to the agencies, particularly NCDC, primary health care, and also, other line ministries that are involved in the PTF. In terms of the terms of reference, nothing has changed. In terms of the structure or the composition of the PTF still remains the composition of the Presidential Steering Committee. So it's just the operations that have been modified, and this does not mean completely that we are relaxing from the emergency mode, but rather we are also just trying to move towards a more sustainable response in the country, as well as to encourage states to take responsibility and also to utilize domestic resources in the response.
All right, Dr. Mohammed, today African leaders, health experts are meeting on vaccination production in Africa, and Nigeria also received its share from COVAX. But a lot of people are wondering, when is the next vaccine on COVID-19 coming? When is the next supply expected in the country?
Well, that is really the big elephant in the room. We've had negotiations at country level through the multinational bodies, that is the COVAX facility, as well as the African Union facility, which is AVAT. However, because of the increased global demand and this vaccine nationalism that is going on, such plans are no longer sacrosanct as we had them before. But we'll continue to make the effort and make sure that Nigeria gets its own fair share of these vaccines. So outside getting these vaccines through these bodies, we're also making some bilateral arrangement with the companies, the manufacturers of these vaccines, as well as the countries where these vaccines are produced.
So at the moment, you can't say a particular date, a month where we would expect the next batch of vaccines?
We have working dates that we are discussing with the manufacturers, but we are not coming out public with these dates because we know, just like in the past, these dates may be shifted because of the what I mentioned, the current demand, global demand, and also the dearth of supply of the vaccines.
Just before we let you go, as we wrap up the program, one final question, and this is for the batch giving to states. What is the order? Is there an order that if they reach half, they would need to preserve the rest so that it completes the 2 doses required for the Oxford-AstraZeneca vaccine?
So we are still discussing that issue. For now, we want to be sure that the vaccines are secured for people who have received their first doses. We are aware that recommendations have been made to states that if they reach this 50%, they can pause with the vaccine. However, we still consider very critical the frontline healthcare workers who have not yet accessed these vaccines, and they are a priority. And regardless of whatever recommendations have been given, this group should be vaccinated anytime they turn up. We are also aware of other exigent circumstances that warrant the provision of these vaccines at the state level. Like I said earlier on, our effort is more towards getting the vaccines into the country than halting the vaccine program itself. So we'll do all the best. We'll put all our effort to ensure that we get these vaccines into the country as soon as possible.
I'd like to thank you, Dr. MUKHTAR Mohammed, National Incident Manager, PSC, Presidential Steering Committee on COVID-19. Thank you for joining us on the program.
Thank you very much. Nice to have me.
All right, and that's it on the program. Continue to take responsibility. You can visit our website for more updates. It's channelstv.com. Stay healthy, stay safe. I'm Millicent Walker. Thanks for joining us.